kidney. And hear reports in a kidney patient in Ghana.
Thank you. It's very, very difficult. Both you, the patient, and the one taking care of you. Both of you are not going to have it easy. Your life, everything becomes shattered. Lifestyle, going out, everything zero. Because there are a lot of things you cannot do. You can't enjoy a life the way it's supposed to be, not necessarily maybe the way you want it. Because it's like, let me use water for example. Every kidney patient is supposed to take 500 ml of water the whole day. Thank God today is raining. When the sun is very hot, you can just imagine.
What's 500 ml?
Yeah, the small
bottle.
The sachet.
Yeah,
one sachet?
Water, yes.
You can't drink more than that.
That is what you're supposed to take for a day. And this thing I'm talking about, if you're supposed to take a tea, you factor it into it. If you like fufu like me, the soup, you factor it into it. If you pour it, you factor it into it because they are all fluid. So you can just imagine living on that one sachet water for the whole day.
I did not know that.
Yeah, it is.
That's tough.
Very.
So you can't consume more than 500 ml of liquids?
It depends, but normally that's what you are supposed to be on. Some can do 750, but normally most of us...
That's still very low.
Very low.
And it's because the kidney is essentially at that stage where it can no longer filter the excess water or waste in the system. So at that stage, we have different stages of kidney failure, chronic kidney failure, or chronic kidney disease. And at that stage, essentially the machine, which is the dialysis machine, will have to filter it for you. That is why they are encouraged to do that, to restrict themselves to the 500 ml of water.
So you can just imagine.
In the climates like ours.
That's what I'm saying. Today, I mean, it's raining. I mean, let's say from June, July, the weather is a bit good. When we were around May, when the weather was
very hot.
You can't stand it.
Yeah, it's tough. It's tough.
You can't stand it at all. And
what else?
Even they will tell you take a mattress size of box of meat or fish.
So what are you allowed to eat?
Normally the dietitian will put you on something, but mostly the grains are good for you. But at the same time, kidney life is very difficult. When you take more of the greens, your potassium goes very up. So that one, you have to minimize it. So eventually, everything, you have to minimize it. Everything, you have to minimize it. They will tell you the greens are good for you. But when you're taking too much of that one too, your potassium goes up. For me, I've not eaten banana for 10 years.
You haven't eaten banana for 10 years because of the potassium?
Potassium. Kontomire, I don't remember the last time I ate kontomire.
What do you eat?
Normally, I do bankum, rice, with some small leaves. Sometimes you take tea small. The tea, you want to take it the way you want. You know we are Ghanaians. So like this cup, full, you take it, but no, you take small. So normally, I'm normally on bankum or rice. Or sometimes you try to eat something. I mean, if you even eat something just small. Just
permit me to say, you look very strong. You don't... I'm sorry, I don't know what a person suffering from any chronic kidney failure is supposed to look like physically. But you seem very strong. You don't seem ill at all. Are you still unwell?
Yeah, let me say it's by His grace, and I try to be more careful. I follow the instructions what the doctors tell me.
Okay.
And I don't let the diseases overtake me. Normally, sometimes I just forget. I just don't think about it.
So are you better than before? Because you've been on this journey for 10 years.
10 years, yeah. No, I was better than what I used to be now.
Really?
But I keep saying, when I see some of my colleagues and I look myself, I just thank God. Like I said, I'm a bit more cautious of whatever I do. And yeah, I'm a bit strong. I wouldn't say stronger, but I'm a bit strong. I'm able to move about, do my own things.
Mm-hmm. And live an okay life.
An okay life.
Do you have any physical scars?
I do. It is here. That is where my fistula is.
That's what it is for the dialysis. Yes.
I can show you.
So they put...
Yeah, it's a fistula. It creates a fistula, a connection between the blood vessels. Yeah. So that they can use that to dialyze him.
So why do you have so many?
For the past 10 years, that's what I've been using to do the dialysis. Ideally, you go there. One is arterial and one is what?
Venous, yes.
Yes.
And arteriovenous.
So how do you create that?
It's a surgical procedure. It's a minor surgical procedure that they do.
Does it hurt?
Okay, like you said, it's a surgery. You don't feel it. They will.
Yes, they will give you anesthesia.
And then they will do it
yes.
for you. But
yes.
with this one, when you go, it's like you be going for hospital. They will give you an injection. So
put it
it's two.
inside.
One here, one is bringing the blood out, and one is returning the blood in you. Normally, the session is for 4 hours. You go.
How often?
Ideally, we are supposed to do 3 times a week.
But for most people, it's not feasible.
Yes.
Yeah, because of the costs involved and
So
other
we do
things,
twice.
logistics and other things. So
Now, maybe we are hearing about it late, but it appears that there's a surge in kidney-related issues lately. Is there?
yes, there is. I mean, kidney disease is something that is plaguing the world. About 850 million people. That's over 10% of the world's population has some form of kidney disease. And even within our country, a study that was conducted and published in 2021 from 2018 data had showed that about 15.7% of cases in the Konfano Teaching Hospital were cases of kidney disease, of which chronic kidney disease was one of the major things affecting patients. Now, to simplify everything, let's just first talk about what the kidney is and how we get the different types of kidney infections. So the kidney is essentially, there are essentially two, normally everyone has two bean-shaped structures around, just below the rib cage at the back. And the kidney is an organ, a very important organ in the body that maintains some form of equilibrium and ensures that everything in the body is equal. It filters the blood, it filters waste, it ensures, it filters waste, it filters water, and it helps in the activation of vitamin D. So if you have a chronic kidney disease, your vitamin D levels are going to be low, but that's very, very important. And it also helps in activating the bone marrow to produce more red blood cells. So you realize that those who have chronic kidney disease are at risk of getting low HB levels, which we call anemia. And that is a very, very important point to know, because anemia can also lead to heart failure. And anytime you have a problem with the kidney, you can also have a problem with the heart, because the kidney is also involved in regulating the body's blood pressure. Yes.
That helps.
Yes.
But what's causing the surge in the numbers we're seeing?
Yes, so we have to take a look at how it happens. So we have in Ghana, we have a lot of people with hypertension that they don't know about. That's high blood pressure they don't know about. We have a lot of people walking around with diabetes that they have no idea of. These are the two major things that are affecting Ghanaians from the data. And when it happens that someone has high blood pressure, the kidney also has vessels, certain vessels. We call them renal. Anytime we talk about kidney, we talk about renal. Yes, so they are renal vessels. So we have the veins and then the arteries. Now, when you have hypertension is essentially high blood pressure, pressure that is flowing at a very high level that's not supposed to be flowing within the vessels. The vessels are like pipes or like tubes. Yes, and what happens with the high blood pressure is that it can also affect the kidney. And when the pressure going to the kidney is too high, either too high or too low, it can cause certain issues in the kidney. It can make certain cells in the kidney die. And when certain cells in the kidney die, it's not able to do its work well. And they do not regenerate. And that's what causes the continuous and progressive decline in the renal function.
But we've seen some children, 18-year-olds, 16-year-olds, 14-year-olds with kidney-related issues.
Yes.
Do they also have a high blood pressure?
No. So for most of the cases in children, let's start from, we also have a high prevalence of sickle cell disease among Black people and African people. So that is one thing because sickle cell disease, in sickle cell, the cells are irregularly shaped like sickles, and so sometimes they can block the renal vessels, and when the blood does not get to the kidney. It's not able to also do its job well. So that is one thing. And also there are also genetic disorders in children and things we call birth defects in children that also contribute to this kidney problems. There are also certain instances that we don't actually know. We've not been able to figure out what exactly is causing these kidney issues in children. And one thing that we should also be concerned about is that, or we should also take note of, is that most of the time when somebody's kidney function or renal function declines, most of the time you don't have any symptoms. It's asymptomatic. So you have to be regularly doing checkups at least once a year. We call something a renal function test. It's a simple blood test you can do every year. You can take it upon yourself to do it every year to ensure that you know what is going on within your kidney. And also, I also want to talk about the use of smoking, and then alcohol also affects the kidney very, very, very much. Smoking narrows the blood vessels, and I said when the blood vessels are narrowed, the blood is not able to go to the kidney for it to do its work of filtering the blood.
Are there specific lifestyle choices that we can make to protect ourselves from possible kidney failure?
Yes, so there are. So number one is, he also mentioned one, that is the diets, usually the plant-based diets. For kidney disease, we do not encourage eating a lot of meat. We want you to eat healthy, so plant-based diet.
I'm saying if you don't have it.
If you don't have it, yes, plant-based diet is best to prevent it. And then also for salt intake is one major thing that can contribute to the high blood pressure I was speaking of if you take too much salt. I'm not saying you shouldn't take any salt, because that can also affect you negatively when it comes to the issue of goiter and you getting your iodine and other things. So just do everything in moderation with the salt. And also, if you are smoking, I would encourage you to stop drinking alcohol, minimize how much alcohol you take. And exercise is also very, very important. Now, another very important thing I also want to talk about is herbal medications. Now, I'm not trying to demonize traditional medicine or herbal medications, but let's look at it like this. You have a medication, a drug, let's say, for instance, paracetamol, common paracetamol. We know what is in the paracetamol. We've done studies and other things to ensure that we know the quantity to take that is not going to be toxic or that's not going to harm us. But most of the time, what you have with these herbal medications and herbal preparations and concoctions is that people tell you to take 1 cup. How much is a cup? What cup are you using? Are you using a vase? Are you using a teacup? How many spoons should I take? We don't know. And any drug can be a poison. And so what we are encouraging is that if you do not know what is in it, it's best not to take it, because we don't know how much of it is affecting the kidney. Yes, and also on the issue of medication, certain medications such as acetaminophen, which is also paracetamol, ibuprofen, and then or brufen, as we normally know it, and as well as the NSAIDs, we call them NSAIDs, aspirin,
diclofenac,
diclofenac. They all affect the kidney.
So we don't have to take too much of that.
Yes.
So you shouldn't hurry up and start taking all these.
Yes, just because you don't have to take a long term. Yes, if you have a headache or something, yes, for 4 days.
Unfortunately, we have to end our conversation now because Roland Walker is on standby in La, talking to constituents of La Dade Kotopon. We've been trying to bring you this conversation all morning. We finally got the opportunity to. So unfortunately, we have to end this now. Please, we'll